Kidney stones is a difficult subject. It is a complex subject. Nobody knows exactly what leads to development of kidney stones, but majority of the time it happens because you're in a hot environment. Your body, you don't drink enough. You become thirsty and dehydrated, and it precipitates crystals in your kidney, and that leads to stone formation. That is one of the commonest theories that is thought of, but there are innumerable other theories as well. Nobody knows how it is caused. There is familial tendencies in people. Okay, some of them have got a genetic background where they throw out too much of calcium. Some people throw out a lot of cysteine, but those are rare. Most of the time is what you eat and lack of drink is what leads to it. A high calcium diet, high uric acid diet, all are the commonest reasons. When you have those and you don't drink enough fluid to flush those away, then you tend to develop stones. They are very painful. It is supposed to be the worst pain a man or a woman can experience. The colic, the urinary colic is supposed to be worse than childbirth pain. Anybody can form stones unless you're careful, but there is no warning signs unless the stone starts moving, in which you get lateralizing abdominal pain, and also you can have blood in the urine. Those are the two commonest signs. The kidney stones, they can produce a lot of mischief. If it drops into the ureter, it can block the kidney. And if the blockage is not detected for a long period of time, even if you treat the stone, the draining tube or the ureter can narrow down what is known as a stricture, and it produces a lot of problems. You can even lose the kidney if it is not treated properly. Majority of the stones, if you leave it alone, it grows. So you will have to either monitor the stone or treat it to make sure that the stone is effectively managed. There's quite a lot of the stones that won't grow, and you can keep on watching it at certain intervals, but the majority of the stones will grow. And if it is in certain positions of the kidney where the stone is, you can predict that these stones can come out and produce a lot of mischief. So those stones get precedence in treatment. They are treated in different ways. You can treat it with what is known as external shockwave lithotripsy, where you lie on this machine which produces shock waves which is concentrated onto the stone, and you break the stone up that way. Or you can do what is known as ureteroscopy, pass a camera up through the water passage. You can go right up to the kidney and deal with stones there. But you have to keep to a certain size. You can't deal with very large stones in the kidney. Those are dealt with what is known as PCNL, where you puncture into the kidney through the back and put a camera through the back and deal with the stone through there, which is known as percutaneous nephrolithotomy.